real nail biter.
Mm-hmm.
Yeah, my family, a lot of them are in California and they're 49ers fans. And I haven't reached out. They didn't say anything to me, so I'm just like, maybe I'll just wait a while until I call one of my brothers. I don't know.
You can wish them happy Valentine's Day with the
I
parade going
know,
on in the
really.
background.
Yeah.
Subtle.
Yeah. Oh, that would go over really well. I don't know. I might just leave that alone for a little bit.
You could also mail them all a championship T-shirt for their birthday.
Yeah.
Right. That would be even better. I don't know.
I love it.
Yeah.
Just get it in the mail.
That's right.
Yeah.
Surprise.
Send them some barbecue.
Yeah, I don't know. We'll see.
Well,
I
we could
might
probably
wait. I
come up
might
with some
wait a
other
little
great
bit on that.
ideas.
I might
Yeah,
wait a
that's
little bit on that correspondence.
that's cute. Well, it's 10 after and 10 after 2:30. In the interest of keeping us on track, we will go ahead and get started with today's meeting. Let's see. I think the only one new to the work is Claire. And Claire, we understand you're an intern with the chamber. So if you don't mind, would you introduce yourself just really quickly and your background and your internship?
Yeah, hi guys. I'm Claire. I'm with the KC Chamber. I work under Grace. I'm a civic and community intern. So I'm just here to learn a little bit more and jumped on this call just to see if there was anything else interesting to learn about.
Love it. We're glad you
Welcome.
could join us. Yeah,
And
thanks so much for being here.
she's a senior at Rockhurst, so she's going to be looking for jobs soon, probably. Just to put that out there for you, Claire.
Always good to know.
Mhm.
Okay, so just as a reminder for the group, we've gone through strategy development. And so this is our first meeting reviewing tactics for each of the 5 strategies that we've come up with for the Kansas City Physical Activity Plan in the business and industry sector. So Natalie has done a great job putting our Jamboard together and getting us started with the Post-it notes. At this point, let's see, we probably should drop the link to the Jamboard in the chat for you all to add Post-it notes yourself if you want to as you think about items. Otherwise, you can just drop them in. Perfect. We can add them as we talk about them. So each strategy has a different or a varying number of tactics associated with them. So we've tried, in order to keep this manageable, we've included about 2 tactics per screen. And we've tried to keep the strategy at the top. So you always have a tactic to prefer. Let's see, you always have a strategy to refer back to with the tactic. And so we can take a look at both of these together. We can keep in mind as we discuss these, we can keep them, we can modify them, we can remove them if you think for whatever reason they're not applicable to our work locally. So on the far side, we've got that area for tweaks and adjustments to the tactics. So I'm going to let Missy take the lead on this, but I think to get us started with each strategy, we'll first run you through the different tactics. So you can see about how many there are, read through what they are before going back to the individual tactic and discussing it specifically.
Perfect. Just looks like Natalie just dropped the Jamboard link in the chat. Just one moment while I open that. Okay, so we are going to kickstart here with this first strategy today. And with the tactics, so this tactic, the first one, we do have Strategy 1, businesses should provide employees opportunities and incentives to adopt and maintain a physical active lifestyle. And the tactics for this include adopting policies that support implementation of evidence-based programs and initiatives to promote physical activity in the workplace, create or enhance access to places for employees to engage in physical activity before, during, and after work hours, combined with informational outreach activities. Design safe and accessible workplace settings that encourage employees to incorporate physical activity in their daily routines, and promote physical activities across multiple environments within workplace settings, including the physical, physiosocial, and cultural and social economical environments. I believe there are also 2 more under strategy 1 that include conduct, periodic workplace-based health screenings that measure physical activity and fitness levels for workers, include measures of fitness components that are relevant to the job types of the workers, and providing resources necessary to support physical activity behavior adoption and maintenance among employees, including access to relevant expertise, evidence-based and behavioral change programs, and well-qualified fitness and behavioral change professionals. So as we go through these, we will definitely also look at the verbiage of each of these tactics, make sure that they zero in on the greater Kansas City area and support the strategy for the greater Kansas City area. And if we need to adjust any of this verbiage, we definitely can do that as we go through each of the tactics. So we'll back up here to tactic 1, adopting policies that support implementation of evidence-based programs and initiatives to promote physical activity in workplace settings. Is this already being done? And then we'll also look at who's doing it well, or are we not sure who's doing it? Are we missing someone in this conversation? What common barriers to success, and then any tweaks and adjustments to tactics. So is this already being done? Let's start with that question. Do we feel that this is already being done?
Like on a company level or on a like organizational promoting this?
On a company level. With
I would say
within businesses, providing employees opportunities and incentives.
I would say yes. Like, I don't think it's ubiquitous, but like that Blue can see is a really great incentives program, and of course everyone that does like corporate challenge and that kind of stuff, but there's a lot that don't have programs like that too.
I think there are many that do, but like you said, a lot that don't.
Yeah, and I think there are several, especially within the Kansas City area, that are doing it well and successfully. So yeah, I agree with that, that yes, it's already being done, but there are many that still need to be brought to the table. Do we know who is doing it well?
So Blue, probably.
Yeah.
If I had to guess, I would say Garmin.
Garmin.
I would say Burns and McDonnell is doing it well.
Children's Mercy.
American Century Investments. Another one I would say does it well.
Lacey, what?
North Point Development does a good job with it as well.
I think AMC does as well. With incentivizing and NAIC.
Yeah.
Yes, absolutely. PNC, yeah.
I think the city of KCMO, they can earn a day off just by participating in corporate challenge. So that's a good incentive.
Yeah. And I know, I don't know about recent, but I know City of Kansas City had a lot of like movement initiatives as well in place. to help promote that within their employees. Any others
you-
that come to mind?
I don't know for sure. Um, I'm kind of looking at our like platinum certified list, which doesn't quite break down what they do specifically in physical activity, but I'm wondering if we can get maybe a smaller organization on this list.
Mm.
I think that Pro Athlete
Mm,
probably does some good work.
yeah, I think that could be a good one.
Mhm.
Yeah.
And maybe, I'm not for sure, but I would imagine Girls on the Run. I know they're very wellness oriented, so I would have to imagine physical activity is part of that, but
Yeah.
maybe not.
I was trying to think of a couple other of our smaller or medium-sized companies.
Does the sports commission still participate in corporate challenge? And are they a group that, I mean, they obviously promote sport and physical activity as part of their business.
Mhm.
I don't know why I'm thinking at some point in the past they had.
They did
were
in
part of
the
a small group.
past, they don't at this time, but they do have access to like a fitness center for their employees. But as I'm not sure what other initiatives they have in-house currently. They would be a good one.
What was that last one again?
The Kansas City Sporting Commission.
Sports Commission and Foundation.
Yeah. They're probably very busy right now.
Yeah, that's right. They were up late and it wasn't because they were all partying.
Yeah. While working very hard.
That's right.
Perfect. And we can come back and add to this as we think of others that come to mind. What are common barriers to success, common barriers to adopting policies that support implementation of these programs and initiatives?
Sometimes it's budget.
Mm-hmm.
That
So
prevents them from putting into place certain types of programming.
also thought just like resources, like staffing just being,
Yeah.
a little tight.
Liability has been a big one historically for us
Mhm.
in terms
Yeah,
of getting this
that's a good
on-site
point.
fitness center.
Mhm.
And then if we're going to host employee activities outside of the hospital, there's always that, well, where are you doing it? And whose event is it? And what's our responsibility?
Mhm. Any other barriers to success or tweaks and adjustments to this tactic? Anything that you feel that needs to be included within the statement?
For this tactic, one of the things I would propose, so it's currently worded as policy. And in our experience with other sectors, policies may be beyond the scope of whether it's programming or organizational, let's see, the ability to impact that within an organization, yet a lot of them have great practices in place. And
Mhm.
so for many of the other sectors, when we mention policies, we include the word practice along with it. So let's assume that you have nothing in place getting started with a practice before you advance to a policy. Maybe beneficial and honestly, maybe all you need, a practice versus a policy.
I think that's a great addition as well. I mean, when we were saying who's doing it well, a lot of it was practices they have in place.
Mhm. Yeah.
In addition to or in place of policies. So I definitely agree with that. Anything else to add on to this tactic before we move along? Number 2 is under businesses should provide employees opportunities and incentives to adopt and maintain a physical active lifestyle is to create or enhance access to places for employees to engage in physical activity before, during, and after work hours, combined with informational outreach activities. Is this being done? I say yes. I work with several
Yes, it is being done.
companies that do in Kansas
Yes.
City.
Yeah.
Who's doing it well? I mean, off the top of my head, American Century Investments, Children's Mercy,
Burns and McDonnell,
Burns McDonald, Hallmark,
Hallmark,
ME
Dairy-
Engineers,
Dairy Farmers.
Mhm.
I think Honeywell has something on site.
Garmin has
Garmin,
something.
yes.
Energy Transfer, H&R Block,
Mhm.
Community America too, I think.
Community America. St. Luke's, City of Kansas City, I know, at least used to have access for their employees to a fitness center.
Mhm.
T-Mobile.
T-Mobile.
Well, I'm gonna throw JCPRD in there
Mm.
in terms of opportunities for employees to be
Yeah.
active
Yeah.
outside of work hours. I mean, they do it both through Corporate Challenge, but they've got community centers.
City of Lee Summit also provides their employees an opportunity to engage in physical activity.
I mean, technically you could add the whole corporate challenge list to this.
Yeah, that's true. Plus about 170 companies.
So we have room for all of those. So
Yeah.
but yeah, there's a lot of companies that provide some sort of, they may not have an on-site fitness center, but they provide the opportunity for.
Engagement and physical activity.
Mhm.
What are common barriers to success with this? Budget.
Budget is a big one.
Space,
Mhm.
depending. If they, if they at this point even have office space.
Employee attitude, like,
Mm.
have the
Yeah.
space, but people feel good stepping away from their desks and losing like traditional, I guess.
Yeah.
Mhm.
Also from like senior people within the
Support
company.
from,
Yeah.
yeah.
The support. And
I'll
then
add one. Um, I'm not actually from Kansas City, but lack of access has been an issue that I've seen. Like some companies aren't willing to like pair up with other companies to provide some place for employees to have like a physical activity center.
That's a good one. Thank you for
Well,
sharing.
I think the budget piece, so to Claire's point, the budget piece is important both for the employer and the employee.
Yes.
So let's say the employer does not have space. That means their budget part is on the employee. And does the employee have it within their budget to be physically active outside of work hours at a convenient location, whether it's a park, their own house, their neighborhood, a park and rec facility like a community center that is generally more affordable than some of the larger fitness centers. What's convenient, you know?
Yeah. Anything that we feel like we need to, any additional barriers that we need to add for barriers to success or tweaks and adjustments for tactics on this one? My only recommendation would be create or enhance access to places or resources for employees to engage in physical activity. There's so much now that is online or you know, you have apps and all sorts of virtual options as well, that just creating that, maybe not a physical place, but that virtual system, and that for them.
I think and instead of or.
Perfect. Yeah.
Yeah.
Because regardless, you know, think about parents of young children or kids who are at the age where you've got multiple kids and multiple activities in multiple places. So while you may be able to afford somewhere or belong somewhere, you know, access to some of the virtual platforms or resources can often be your best bet.
Yeah, and combining those with, you know, those informational outreach activities. I mean, I've seen where companies have done one-off like step challenges and things like that, that utilize those apps and tracking systems that might not be that physical location. So yeah, I think that's important to, especially in post-COVID world where that is more and more common to see companies implementing. Good addition. All right, moving along here to number 3. So design a safe and accessible workplace setting that encourage employees to incorporate physical activity in their daily routines. Is this already being done? I think we can agree, yes. Who's doing it well? Is someone missing? Are we not sure?
I think I would say Dairy Farmers of America does a really good job of incorporating some things within their workplace setting that lend itself to being physically active. They have like a walking path right outside. They have a bocce ball court. They have a basketball court outside.
And they encourage employees to go out
Yeah,
and use
they
those
they
areas
do.
regularly.
They're always coming through to get bocce balls and basketballs and yeah.
And then do we feel like there are any common barriers to success?
Culture.
Mm-hmm.
Mhm.
The changing landscape of work field with a lot of folks being, working remotely, that's a little bit tricky.
Mm-hmm.
Yeah, that's a great point.
And sometimes it's culture. That was the thing that I was really gonna. Because I mean, I know of at least one or two that have on-site fitness centers, and they do corporate challenge, but then kind of their internal culture doesn't always lend itself to encouraging employees to go utilize what they have on site. So I think culture is a big part of it. They don't allow for the time really for employees necessarily to utilize it as much as they could.
Here's one other thing that I sort of noticed, then you can tell me if this is the place you think it fits, but I see a lot of people overthinking this. Like if you can't put in infrastructure or walking paths, then you're not doing this. We've done a few things that are not, I mean, it's not, it doesn't result in huge amounts of physical activity, but in our quarterly meetings, we encourage standing ovations. So the meetings are about 2 hours. And so instead of just sitting there on your butt, watching or half watching or listening or half listening to presentations, after the presentations are done, standing ovation, which both gets you up off your rear end, but and also recognizes the presenter. In person, well, and in the past, when we were doing this in person, we would lead physical activity breaks in the middle of the meeting. So presenter would get done, then we'd go on into other updates with a quick little, whether it's a video or an individual leading this physical activity breaks. We would
I was going to
encourage
say, yeah, Children's
those.
Mercy does do that. And yeah, and they do that.
Yeah.
They utilize, we have staff there in the fitness center with
Yeah.
Corporate Fitness Works, and they are starting to utilize those on-site in-person breaks
Well,
a little bit more now. Yeah.
We had your staff. This is back when Mackenzie Helmick was
Oh, sure. Yeah.
our main staff person, or one of the main staff people in there. We had her virtual, so
yeah, she did some
she was
virtual stuff as
live.
well. Yeah.
She was live. We recorded it, but she led the group through a stretch break, and then we recorded that, and sometimes we'll reuse that during our quarterly meetings, or if we can have, we like to encourage lots of different people to do it. And now we have new staff out there. Gabby, we hope to have Gabby involved in doing some of these things as well. But I often think people think that if we're not doing a fitness center, if we're not doing a path, or if we're not doing something else, it doesn't matter or it doesn't count. And they overthink it, and they neglect these little things like, hey, just get up and walk around your building, or get up and walk around your house, or get up and go put a load of laundry in if you're working at home instead of
right. Yeah.
Just sitting. Yeah. Natalie, did you add just overthinking it as a barrier to the success of it?
Yeah, I think that's a really good point. I think that people don't necessarily think about that piece of it.
Any adjustments to this tactic with the verbiage of the tactic itself?
I guess I would say it was initially a little confusing to me because I guess when I see the word like design safe and accessible, it makes me think of like physical altercations to this like actual space. Which then I would think like, or where that companies would think, oh, well, this is the building that we have and we can't, do anything about that. So I don't know, like it makes sense after I was listening to the conversation and hearing it explained, but that was kind of my initial interpretation of it, I guess.
So you were thinking physical, like four walls of a workplace setting versus like a overall culture
Yeah.
and
Yeah.
and just like practices within that workplace environment.
Yeah.
Maybe instead of
Maybe-
settings, environment. Workplace environment that encourages employees to incorporate physical activity in their daily routines.
Does that
Okay.
still lead you to kind of think in terms of you have to have a physical place to do, maybe it's practices again. Maybe it's, I don't know. I kind of like
like
that word.
culture, maybe
You know.
What was that, Grace?
adding culture, like keeping like the
Mhm.
settings, but like settings and culture to kind
Yeah.
of get that other piece of it, I guess, the less limiting kind of. I don't know.
Yeah, like design safe and accessible workplace settings, encourage a culture or support a culture that encourages employees to incorporate physical
Mhm.
activity into their daily routines. And then the other piece I would add is no matter where they work. And it didn't have to be worded that way, but
In
I'm
their
trying to,
daily
Just in there.
that meets them where they are, or in their daily routines, whether on-site, hybrid, or work from home,
yes.
or
something-
off-site,
that's the
on-site,
whole-
hybrid, or off-site.
Yeah, that's the whole idea I'm trying to get at. How we
Yeah.
word it, I'm not entirely sure.
Yeah.
But I think we want to be sure that we're calling that out for a tactic here.
Yeah. Workplace settings that encourage an employee culture to incorporate physical activity into their daily routines, whether on-site, hybrid, or I guess it would just need to be
Like-
on-site or
Like no
hybrid
matter
or
where their
off-site
work location, no matter where their work location is.
into their daily routines, regardless of their work, of their physical
Location.
work location.
Yeah.
Yeah.
I mean, think about it when you're traveling, we want to encourage that as well.
Yeah. Daily routines regardless of work location. Natalie, did you catch all that?
No, guys.
I
Why?
can say it one more time.
Okay.
Okay, correct me if I'm wrong, everybody. Design safe and accessible workplace settings that encourage employee culture to incorporate physical activity into their daily routines, regardless of the work location. Is that right? Is that what we came down to? Regardless of their work setting, of their work location. I think that's right.
Encourage.
Here, I'm putting in a couple of post-it notes. that
Perfect.
Help us remember
We might
what
have
we're
to,
talking
I was
about.
gonna say, we might have to like finagle
Yeah.
this verbiage
Yeah.
later on, but. Okay. All right. Are we ready to move on to tactic 4? We feel good with where we're leaving 3? Yeah. Okay. All right. Number 4 on strategy 1 of businesses should provide employee opportunities and incentives to adopt and maintain a physical active lifestyle. We want to promote physical activity across multiple environments within the workplace setting, including the physical, physiosocial, and cultural and getting tongue-tied on that one, socioeconomic environments. So this kind of encompasses that above one, I feel like, what we were trying to say, where it's all meet them where they are. Yes, I think this is already being done. Children's Mercy is a great example of this. They have an on-site fitness center. They also have a virtual platform that they offer, as well as Shelley was saying, those meeting initiatives that take place in the moment. They have an outdoor space for people that encourage people to get outside and into the sunshine.
Yeah, we have places to sit outside and we have a garden. And we
I
have
think
a
Dairy Farmers is
playground.
another good one. Yeah. What are common barriers to success? Probably resources. Some probably aren't sure how to reach all of those needs, where to start.
Time.
The time and the manpower to create those opportunities, or the budget. Shelley, I think to your point on the previous tactic, oftentimes the small things get overlooked because they might underestimate the impact.
Yes.
All those small things add up to a big thing.
Children's Mercy employees may not agree with this, but our facilities provided a bit of a nudge to increase physical activity by the location of the parking garage. It's about a block from the main campus hospital location. So many people whose offices or work is in the inpatient setting or our outpatient clinics have to park in the parking garage, walk a block to get into the Adele Hall campus and to their work location. So by just the simple design of where the parking garage was going to be, and this is, I mean, like there are a whole bunch of reasons that went into why the location is where it is, but employees are now more physically active whether they want it to be or not.
They have to park and walk, park farther away. I always do that anyway. I'm a far parker. I always park way far away from everything. Just get some extra steps in.
Yeah. Any tweaks or adjustments to the tactic itself? I feel like it's pretty encompassing.
I don't mean to be nitpicking, and it may just be me, but so what would it mean to promote physical activity in a socioeconomic environment? Like, is that trying to say we're making it accessible for our employees at kind of all
My guess,
socioeconomic levels, or?
yes, and here's the example that I am going to use that Children's Mercy does from a socioeconomic standpoint. Our fitness center is available to all employees. The cost to join the fitness center is, I think it's like $6, and this may not, this.
It's $6 a pay period. Yep.
Yes, I don't know if this is widely known or not, or if we should even be promoting it. I'm not entirely sure, but it is affordable. It is the whole month. Most months, it's $12 a month. From an affordability standpoint, that is frequently the cost of a day pass to attend a class at a facility. Our fitness center is now accessible to members 24/7. It's staffed less than that. So if you wanted to work with the trainer, or if you wanted to ask questions, or if you didn't want to be the only one in there, although it's a very safe environment, it's badge protected, a whole bunch of other safety features along with it. It's very reasonable. So from a socioeconomic perspective, it is cheaper than really any other fitness facility from a monthly cost perspective that I've ever seen.
Yeah.
In addition, there are also, and these are just one-offs, we offer classes that are accessible to all employees at no additional cost. An example would be, and I think we partnered with the chamber to do this. We had a yoga instructor come to Hospital Hill Park and lead a yoga session out there. I think there were 60 people. Maybe we just promoted it across the Hospital Hill camp or the Health Science District campus. I can't remember. Anyway, that would be another example. While it's not physical activity every day or even every month, it certainly is, providing an opportunity. And I think this is in one of the previous tactics, where you partner with other things that are going on or other outreach activities. It certainly does. Those one-offs help to promote, whether it's the fitness center or why physical activity is important. And yes, you can do yoga. Anybody can. And here are some other ways to follow up with this after being introduced to the first class that don't cost you $25 every session or $100 a month to join a yoga studio. And so I think that is one of the ways that socioeconomic environments can be addressed. The
I
other
think
piece that go ahead. Nancy.
Oh, I was just going to say, I think another example of this is companies that pay for and provide corporate challenge to their employees because they're promoting that physical activity. It's at no cost to the employee themselves. And they're providing that opportunity all around the city for folks to get together and be physically active together, regardless of, where they may be physically located or their office may be physically located within Kansas City. So I was just going to say, I think that's another, socioeconomic environment that promotes, across the board, it's affordable, it's free for employees. And it gets our employees up out of the office and moving.
I guess, in terms of wording, I mean, if we said something like being inclusive of like these factors, or if everyone else understood what it meant, that's totally fine. And I just may be the outlier there.
No, I think that's an excellent point. I think rewording it to have that part be more clear is really a good idea. And that's definitely a tweak we can make to this. And an easy one. I mean, we don't want people to think, well, does that apply to me or does that not apply to me?
So something to the extent of socioeconomic environments to meet the needs of
what if it was like promote physical activity across multiple environments within the workplace setting, with or being intentional to include like different socioeconomic levels, or like that's not quite right.
I like where you're going. I think we can move the word environments. So we can say promote physical activity across multiple environments within the work setting, including
I see what you're saying, where you just like move environments up by setting so that it's more clear that we're encompassing all environments and needs.
And we could change that last one to barriers or so within the workplace setting to address physical, psychosocial, cultural, socioeconomic barriers or obstacles.
Yes.
Does that make a little bit more sense, Grace, in terms of
I think so.
what you brought up? Okay.
Yeah.
Because really, I mean, this sort of addresses, if you think about physical, we should be thinking about people of all abilities. Cultural would be dress. So are we making it comfortable for people? No. And this makes me specifically think of women who wear hijabs. And are we giving them a place to either change the rest of their clothes or I don't know. It just makes me think of that specifically. Are we addressing that from a socioeconomic perspective? Are we making sure that we're offering opportunities that are low cost, no cost, subsidized, whatever that looks like?
Correct. Yeah. All right. I know we're getting to the end of our hour. Do we want to try to get through 5 and 6 here really quickly? Do you feel like we have time to get through these next two? Okay.
I love it. That would help us get through strategy 1.
All right, so let's dive into 5. Conduct periodic workplace-based health screenings that measure physical activity and fitness levels of workers. Include measures of fitness components that are relevant to the job types of the workers. Examples are by 2025 adopt consensus physical activity, physical fitness, and sedentary behavior assessment standards for physical activity screenings within the workplace. I do think places are already doing this. They're having their employees complete, step tests, fit screenings, health screenings, many times associated with their health insurance, like Blue KC. Blue KC is doing it well. I'll just throw that out there. Any others off?
Brinson McDonald does a good job of this, and American Century does as well.
Common barriers to success. I think I would just say some companies or businesses have hesitancies because of privacy. Oftentimes it needs to be done by a third party. Or through the insurance, which they then don't, it's hard to measure because it's through insurance. Any other barriers?
Yeah, I think this one's a bit challenging because if you're truly trying to measure, physical activity and fitness levels versus just self-report, that there are challenges in doing that. Do individuals want to participate in what it takes for an actual physical activity assessment versus just saying, I'm active this many days a week?
Yeah.
So most assessments include a question about physical activity, and I think maybe that's the question we need to include in our tweak or adjustment to the tactic. Are we, and maybe we become a little bit more specific in our tactic as a result of this. Are we actually talking about measuring? Because this currently says measure versus screen.
Yeah.
I would call or question, or
I would almost.
I'm trying to think how to be clear
personally,
on that, what you're saying, what we're
yeah,
trying to say.
personally, I would almost change include to be not limited to measures, screenings, or offerings of fitness components that are relevant to the job worker. So that would And that would then give us the opportunity to say, you know, Hallmark does a step test for all of their employees. Well, they're providing that offering, but we're not going to get any of that data because all of that data is being collected by their health insurance. So that would give us an opportunity to encourage the offerings of for employees without like necessarily having that
Infringing on privacy.
yeah kind of
Yeah.
give us a broader reach where we could have those opportunities of actual measurements happening, but instead gives us that broader reach to encourage companies to provide some sort of an offering to their employees without like us having any way of, you know, the company any way of having that data or that third party opt-in. So instead of include, say, something like not limited to screenings, offerings, or measurements of fitness components, and kind of encompass all three. I think the screenings I know are pretty similar to measures, but as far as like verbiage in the world, in this world, I feel like screenings is going to speak more widely to people since they are often labeled some sort of a like health screening.
Yeah. And in most cases, so there's the health risk assessment, which is basically answering a bunch of questions. The
Yeah.
health screening, which is actually taking measurements. So height, weight, calculate BMI, maybe a screen for cholesterol.
Yeah.
Let's see, I'm trying to think. There are other types of things that you could, I think we measure in our fasting labs that can easily be collected on site in your health screening.
Yeah.
And none of those that we do are actual fitness assessments unless we specifically request that and you're a member of the fitness center. So I think we want to make sure that we're trying to and we need to decide if we want to encompass all of those things or have a minimum. So anyway, that's why I put just that note in there for consideration as we sort of tweak and finalize these things. Today, we're really just sort of thinking through what are the things we might be missing, how do we address some of these things, and what do we need clarification on. We can try to do some rewording for the last meeting when we are finally reviewing all the strategies and tactics. We have those notes in here.
Perfect. And then that last tactic, provide resources necessary to support physical activity behavior adoption and maintenance among employees, including access to relevant expertise, evidence-based behavioral change programs, and well-qualified fitness behavior change professionals. I can say this is already being done because I work as a resource. I think several companies within the greater Kansas City area are providing this. Corporate Fitness Works provides this for many companies within the Kansas City area. Yeah. Anyone else who is doing it well?
I think the organizations that include both the fitness center and then the on-site health clinics, those are the ones that are doing this the best. And like
Hallmark
those would be models.
Yeah.
Everybody can't do that. Like there are some businesses that just aren't big enough to do that, don't have the employee base to make an on-site health center affordable.
Yeah. Hallmark Crown Center does this. So does
Burns and McDonald does.
We do it. Children's Mercy
Oracle does have the both of those options. Though I know they've kind of adjusted in recent years.
No, yeah, they still do.
Ours is now Marathon Health.
Common barriers to success. Shelley, you said space, right?
Space, size of the organization.
Mhm.
So if you don't have the
Mhm.
employee base, it's not going to be economically feasible to
Yeah.
do this. So
Mhm.
you need a physical location. If you were going to integrate this within your organization, space, employee base, cost, etc. I
Mhm.
think Blue KC has or had an option. So they had, I'm gonna say it was like neighborhood clinics that were affiliated with some of their plans. And I could be saying this wrong. It's been a number of years since I even thought about this, or it was pre-COVID when they were
Mm.
first launching the concept. And I don't actually know where it is at this point, but the idea of trying to get your healthcare provider in a convenient location, whether it's at your employer or near your house, is
We'll
always
have like a
challenging.
van now. I'm not sure if it's the same thing, but it'll be at the event in March.
Oh.
So you can check it out.
I was also going to add on who's doing this well. NAIC. They have on-site behavioral change professionals. So does Garmin, Tanya. That's, yeah. So I would say that, and correct me if I'm wrong, I think Locked-In does also. Yeah. Any tweaks to this? I feel like it's pretty all-encompassing for what it's stating, but I've looked at this a million times. Does anyone else have anything they think that should be added to it? If not, that wraps up strategy 1. As we move through these next few meetings, we'll be diving into strategy 2 through 5. I think 1 has one of the more longer list of tactics. So, but we will continue to move through strategies 2 through 5. If you want to take a look at the tactics ahead of time, they do mirror closely to that national physical activity plan currently. And we will continue to tweak and adjust as we move through them. But I know if you want to kind of marinate on it for a little, ahead of the meeting, they are going to be similar to what that national plan is right now. If you want to take a peek ahead of time. And Shelley, I'll turn it back over to you.
Great. Well, thank you everyone for participating today. We will, let's see. I don't know how easy it is for you all to access this information in between meetings, but feel free to save the link to the Jamboard to come back to it if you want to share it with others. Some people couldn't make it today. And in order to keep this work moving forward, we're going to try to avoid going back and re-looking at the previous strategies so we can do our best to stay on track with getting through the tactic review. We may also consider sending some of this out for consideration in a survey format. What do you all think about that idea? At least that would give you a chance to look at the strategies along with the tactics and make notes to yourself about where it might already be done. We might be able to get through a few more of these in a maybe a little bit more efficient way, and we could get feedback from those who are not able to attend a meeting as well, if the time is inconvenient.
I love that, especially for those that weren't able to attend today. Give them that opportunity to take a peek and share their thoughts.
Yeah. Okay. So Natalie and I will work on that piece and try to get that a link out to you all, well, everybody in the group, with just some brief instructions about what it is. And the intent is not that you have to complete a survey. It's really take a look at this, make some notes to yourself, bring it back to our next meeting.
Mhm.
And then we can quickly add these things to our Jamboard and maybe get through a couple of strategies, the tactics for a couple of strategies during the meeting.
Perfect. And as a reminder that thank you, Natalie, for dropping in that National Physical Activity Plan PDF. And then the March 11th meeting, our next meeting, is also in that chat. So you can all get it on your calendars. Any other final thoughts? If not, I want to thank you all for joining us today. A special thanks to Claire for joining and
Yeah.
contributing. And I will see you all in a month.
Hey, Missy, can
Yeah.
can you stay on? And Natalie, can you stay on for just a second?
Yeah.
Shelley, I've got like 2 minutes before I'm supposed to meet with Bill and Adrian too. Right. So I got a
Okay,
minute.
I can
but
follow
okay.
up with you in the morning then,
Okay.
Natalie. Okay. Bye, everyone.
Bye. It might kick us off,
It
Shelley.
might though if I leave.
Can you just
And
leave it open?
it's still recording too. You might stop the recording.
Are you on a Zoom meeting with them, Natalie?
No, I'm gonna be on a Teams.
Okay, you may be able to have both open and then I can